Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, and welcome to Let's Talk Together. I'm Sherry Harlan, program host for Let's Talk Together, and today we are discussing Reid Podiatry. And before we get started, I'd like to introduce our guest, Dr. Alicia Jones, Dr. Casey Crow, and Dr. Brandon Baker. Welcome.
Thank you.
And before we get into this, I'm going to ask each one of you how you came to Reid and how long you've been here. We start with you, Dr. Jones. No pressure.
I have been in the Richmond community for about 9 years, and I'm originally from Iowa, so I made a lateral move. But I've been doing surgeries at Reid all that time. But I have officially joined Reid 5 years ago.
Okay. Kate?
Yeah, I have a little longer history. I grew up in Richmond. I was born at Reid, the old building, but at Reid. Moved away for school and training, and then Dr. Baker and I were in private practice over closer between Anderson and Noblesville for a couple years, and then I joined Reid just actually 2 weeks before Dr. Jones, I believe, about 5 years ago. So been here since then.
Does that mean I've been here 4 years?
Probably for
4 years.
A little less, yeah.
So we worked together in Anderson. I came later once we got busy enough we needed another spot. And then not present today is Dr. McKellar, and we've continued to grow the practice and get busier. And he is on vacation today, but we just recruited him from Texas about a year ago. So,
Well, we're real excited to have you. And also that you two are married.
Yes, yeah, yeah. We did residency together in Utah. We met in school in Chicago. Did school in Chicago, 3 years of residency in Utah, and then came back to Indiana.
So, Dr. Crow, we can say that you're a good salesperson, huh?
Yeah, sold Richmond, yeah.
To get you. So, anyway, when we talk about podiatry, what is podiatry?
Well, it's not the treatment of just kids. We get that a lot.
Pediatrics
Yeah,
and podiatry.
yeah.
Okay.
Foot and ankle, yeah.
Foot and ankle, it can be surgical, can be non-surgical, combination of both. We treat a ton of pathologies from toenails to ankle instability. So.
And what kind of conditions do podiatrists treat?
Yeah, I usually tell people, the scope of podiatry, and we are a limited scope practice. So when you come in and you're like, can we talk about these other things? Actually, a podiatric license is below the knee. So when we say no, it's not because we don't want to treat you. It's because really that's what our specialty is. So I think it's important to realize that. And then, but in our scope, I usually say it's skin to bone. I mean, it's everything from conditions of the skin all the way down to things with the bone, whether it be deformity or trauma, fractures, and then all the soft tissue in between. Everything from injuries to chronic pain, deformity, things that have been going on for a short time, a long time. Really, it's we're all pretty broad in our scope as far as in the foot and ankle.
And also included in that it would be wound care too.
Oh yeah, sure.
That was my next question.
Oh, was it? Sorry to steal your thunder.
You just stole my thunder. Okay.
But yeah, we all three of us spend time at our wound healing center. We each are there half a day every week to treat wounds of the feet. Unfortunately, it can happen and does require pretty frequent weekly visits until we get those healed. Yeah.
And so are those people coming to your office, or are you going to the wound center.
To the wound center.
That's a
So
good question.
we'll spend majority of our clinic time at the office, which is behind Frickers on Highland. Yeah. But the wound healing center is across from where the hospital used to be, down by that primary care building. We all go there to see patients too.
Next to the 1350 building. So.
Yeah.
We're a little bit of everywhere. We also take care of patients in the hospital during admissions, and then I've been going down to Connorsville for about 4 years. So I see patients at the specialty clinic that's attached to the urgent care off of 44. So I'm down there once a week too. So for the Connorsville community, there's a little bit of a closer place to go if you need to see one of us.
And so when the new hospital opens, will you continue?
Yes, I'll continue going to Connorsville, and from what I've heard, I'll be at the new location.
Right.
Is the what I've heard so far. So yeah.
So we spend quite a bit of time, and we'll be there Thursday.
Yes.
And in Connorsville. So that's part of the Reid service area.
Yeah.
And they're really excited about the new building.
Yeah.
And when should you see a podiatrist?
Oh, anything that's really concerning, I guess, involving your foot or ankle. But that could be anything from, we see a lot of thickened toenails. We can explain to you why they're thickened. Could be fungal, could not be. Maybe just nail dystrophy from that. All the way from ingrown toenails. Maybe you've got a suspicious looking lesion on your foot. We see soft tissue masses. So something that way. Biomechanical, we see bunions, hammer toes. Those conditions, you could live your whole life with a bunion and hammer toe and never be bothered by it. It's when it becomes bothersome. You can't wear shoes. You want shoe advice. How do I accommodate these pathologies on my feet? That's when you should involve podiatry. Of course, there's injuries. We see those as well. So those would be something you want to be seen more acutely for.
And on a separate note, so you get to be the people that at the party, people walk up to you and
Yes.
you want to see my foot?
Yes. I don't know if they do that to other
That's happened to all of us,
specialties,
yeah.
but that's a for sure with us.
Yes. Often we get that out, being out in the community, they will say, you work at Reid. I'm like, but I'm not clinical.
Yeah, let me
I'm
be
not
clear.
clinical. But that doesn't matter because they'll see my Reid badge.
Yeah.
And then they plop whatever part of their body they see. You see this? What is this? Like, I have no idea. So I'm sure that you get that a lot. When we're looking at when you should see, when you were saying some of the things that you can see,
Yep.
what's some of the typical processes? Because everybody wants that magic wand to go past it, and that problem goes away.
Yeah.
What about typical times or for healing?
I know I begin my encounters often saying, your pain's been here maybe for a year, maybe for a week, but it is going to take some time. It might take a few visits. It might take, the easiest thing first and then going to the next step. Maybe it starts with just some exercises and anti-inflammatories and maybe some arch supports. And then maybe if that doesn't work, we go to an injection. Maybe if that doesn't work, we go to, talking about things surgical and of that nature. But I always tell patients on a first visit with a new patient, be patient. We'll get to the bottom of this, but it might take a little detective work along the way. So, I think that as far as what we see, Dr.
I
Baker can
will
comment.
add that there are some things that are fairly common that we can treat at that first visit, like an ingrown toenail. Usually every day I
Yep.
see 1 or 2 ingrown toenails. We do an in-office procedure for that to treat it. And so in that sense, that's something you come in with it hurting and leave ideally with it having been fixed. Plantar fasciitis is another one that's fairly common. That's pain underneath the
could you
heel.
explain?
Absolutely, yeah. Pain underneath the heel. The first step you take when you get up, it hurts. That is a common thing. Now, maybe not something we could fix that visit, but we could talk about things that they could do to help it on their own at home. I could give a shot, a steroid injection to make that feel better. But so yeah, there's a lot of common things that we all 4 of us will see. Ingrown toenails, plantar fasciitis, things like that. And not everything needs surgery. So all of us are surgical. All of us have time in the OR every week. but we're not taking every patient we see to surgery. In fact, I think most of our goals is to try to treat you conservatively, but we have that surgical option should everything else fail. Yeah.
Another challenge I'm sure that you have are patients that are non-compliant.
I think
everyone smiled.
I think every provider eventually will have to, try to guide someone that isn't adhering to the recommendations through their treatment. Then that would make it a little bit more challenging.
I think it's challenging for Dr. Crowell and I as females because I feel like we have kind of a more emotional vested interest than maybe some of our partners. I love that Dr. Baker and Dr. McKellar, they love their patients, they really do, but Dr. Crowell and I just kind of struggle with that maybe a little bit more. We want the best for all of our patients to do well, and non-compliance is something that I do myself. It's a struggle for me personally because I'm human, and these patients are human, and they are not faultless. But we definitely strive to do the best we can, and our goal is to get you back on your feet truly. With the best compliance that we can get for you. And we try to make that as easy as we can too. We give you the tools to make you as compliant as you can be.
I've told my patients before that this is going to take a team effort. I can be part of the team, but I don't have a magic wand. You have to be part of the team too. So to get good results, I do think it's important for people to understand that if you don't do your part and you're not going to follow the things, that probably the problem is going to persist. So I think that it's helped me to be upfront with patients about that, and like Dr. Jones said, we're all guilty. Sometimes,
Right.
people in healthcare make bad patients as well because we know everyone's busy, everyone has things to do, and we don't, patients included, we don't make ourselves the priority in getting better. We've got families, we've got responsibilities, and sometimes that stretching twice a day isn't in the books. So I think that having realistic expectations coming in, that we're not magicians, we can, kind of be part of the team, maybe even lead the team, but that it's going to take the effort. I think it's, and then, from the patient perspective, if they come in and they haven't done the things, I always appreciate that when they're like, I know I'm not 100% better, but I can do this better, as opposed to, why am I not better yet? Well, did you do these things? No, that's always more frustrating. I think it's just being part of the same team. It's kind of how I talk to my kids too. If we could be on the same team, then we have less arguments. Everyone does better, so.
Right. That's always a challenge. Mm-hmm. And no one likes to be told that they weren't compliant, but it's like, you're not getting any better, so. And when you're saying also, often healthcare, people in healthcare can be the worst patients. I know. So,
Yep.
I had a call from someone I was working on different, and they were like, I think I know you. And I said, oh, maybe you don't. Then they told me something I did. I'm like, yeah, that was me. So I was in my own house by myself, and I put my head down. I was so embarrassed. So I know the other side of being non-compliant.
Challenges.
We have one of the other things. When people come to see you, what are one of the challenges we've had prior, and we want to make sure people are aware that there's not a long wait.
Right, yeah. I think all of us have openings built into our schedules for urgent kind of same-day add-ons. I tell most patients that I see, if we can't get you on the same day, we're going to try our best at least to get you in the next day or the day after, at least that same week. But I think every day this past week I've seen someone added onto my schedule because I've had an opening and someone has come in that needed something. So we don't have waits in our clinic like some other clinics might. I mean, I think the longest out might be for Dr. Crowell, just because she's splitting her time into Connersville, and there might be a longer wait there because you're only there one day a week. But yeah, we do our best to get people on the same day, especially for things that obviously need it. Infections, wounds, the ingrown toenails, like we talked about, any kind of trauma. One thing I like about our clinic is we also have the orthopedic walk-in clinic that exists in the same building. So it's.
And can you
right
tell us
around
about the walk-in clinic?
Yeah, they're open 8 to 8. Yeah, Monday through Friday.
I think so. I believe that's the hours.
And so there's a big window of time availability for people to come in and see. For us lately, if there is something that comes into the walk-in that's foot or ankle related that we can see, certainly if it's an existing patient of ours, they're going to look at all of our schedules to find an opening to put that person onto. So that is great. They stay busy over there, yeah. And they do a great job. I like the communication too between the walk-in providers and us. They'll come over, show us an X-ray, say, hey, what do you think about this? If they can't get that person onto our schedule, so we're still kind of involved, and we'll tell them if they have any questions, what to do, or find a place to put them onto our schedule in the next week.
Now, they differ a little bit from your urgent care setting outside of the hospital facility, Meyer Walk-in Clinic, and those kind of places. They're not seeing your strep throats and things like that. We're talking about musculoskeletal injuries or aches and pains. So pickleball's picking up a lot. Here in the summer, they'll see knee injuries, back pain, hip pain, things like that. When it comes, like you said, Dr. Baker said, when it comes to foot and ankle injuries, we do try to divert them onto our schedule if we have an opening. There are days where we just don't have an opening, and that is a great place to be seen as a backup overflow for them to be seen as a first come, first serve basis.
So if someone, and one of the things at the walk-in clinic, there are X-ray machines, or how does that work?
Yep.
Yep, it's all housed in the same building. We're just right around the corner from the walk-in clinic. There's also spine and pain management and orthopedics, and there's like an athletic training center at the front of the building. So we one-stop shop for all things bone and joint.
I think it's important for our office too. We have X-ray in-house for us. So if you come to an appointment with one of the podiatrists and say you do need X-rays, that basic imaging, typically our nurses will go in and triage, find out what's going on, and if it sounds to be something that might be bone or joint related, or something that we might need an X-ray, even if it's just a baseline, we'll often get the X-rays before you even see us, and we all evaluate our own X-ray images because they're done right in-house. So when you come to see one of us, typically we've already looked at your X-rays that you just got, and we're ready to discuss, what we found. We can show you the X-rays. We can kind of talk about things. Maybe it's bone related, maybe not. Maybe we need to do an exam to figure out what's going on. But you can expect that an X-ray, if you need it, will be done same day that you see us, and that's no problem.
So you can stop people like me who can out my chart.
Yeah. Sometimes I'll walk in to see a patient and they'll be on their phone and they'll say, oh, I just got your report, because I'll dictate my report in and then go in and see the patient, and they'll get it immediately on my chart. So, yeah. And
in the event that you already had X-rays, you went to an outside facility, we do have a way of seeing those X-rays, but it takes a little bit of extra time. We just have to call the facility and have them upload them to an outside source, a cloud service, and then we can download them to our system and see them for our own evaluation.
We have...
I will add one more thing about just walk-in and coming into the clinic. It never hurts to call ahead. Like sometimes the walk-in clinic could be fairly backed up, have a wait of a couple hours, not in like the ER, just if a bunch of people come at the same time. Or they might say, oh, this is a foot-related thing, you could see Dr. Baker, but his urgent add-on opening isn't for like another hour. So if you know it's related to something that we might see with your foot, and you don't have an appointment but want to be seen, just call the office, and they could put you through to someone on my team to find a place that'll work for you.
And Sherry, I think you asked that kind of differentiating when to go to the walk-in versus when to go straight to podiatry. It's never wrong to just try to get to us. If it's your foot and ankle, we get a lot of referrals from the walk-in. People that have been seen for an initial visit in the walk-in, which is fine, but then you're gonna come see us for the follow-up or for, so we're completely willing to take you on from the beginning if that's possible. So I guess that one way to look at it would be, as far as the walk-in goes, you can always call ahead, but there's gonna be accidents. Maybe you fell and worried you broke a bone, and it's 6 o'clock, so we're not there, but the walk-in is great for that. But maybe this is pain that you've had for a month or a week or even a couple days, and you say, well, I could call and maybe wait till a certain time today or tomorrow. It's always, if it's, not something that's emergent and falls outside of those hours that we're there, we're typically there until 5, I'd say, all of us. It doesn't hurt to call and just find out, because you might be able to get straight in with one of us.
And once again, this is something that I don't think the community was aware of, that you have availability and there are options.
Yeah, I think that years ago, there was a time when me and Dr. Jones were kind of on our own. There were 2 of us.
Yeah.
And we had a community to support 4 of us. And then as Dr. Baker came on, things started to open up a little bit more. And then we got bottlenecked again. And then Reid was very focused on let's get it to where patients can come in. And they were supportive of bringing on the 4th podiatrist. So now we have pretty open availability for the first time in probably five years.
The last 5 years,
really,
for sure.
because there is a need in the community for providers. And our group at this time, we can support that, and we can be there for people in a very timely manner. So I do think that some of the community may have had experiences even 1 or 2 years ago, even before Dr. McKellar came on, where our 3 schedules were even booked out a month, and now it's just not that way. So if you thought, well, I tried last year and it was going to be 2 months to see one of the podiatrists, I'm just going to go to the walk-in. That's probably not the case anymore. We have the manpower to support much more quick appointments. So.
And in addition, I have to do a shameless plug that our athletic trainers are in that building, as well as the different options available for more therapy.
And the perioperative clinic.
Yep.
So so patients getting surgery, all our patients that end up in the operating room with one of us, to get optimized for that surgery, they'll meet some of the providers, or at least one of the providers at the perioperative clinic.
And that don't think often people don't realize there's a lot of different buildings that say Reid, and what's in those different buildings, and so this is explaining what's in that building behind Frickers. So, and
right
actually,
by the water tower.
Our community engagement, our community health team has moved to that office as well.
Oh, cool.
So, even though I never get to see you guys, because we're usually out in the community. So,
That's right.
But there's a lot of different moving parts, and as people are coming in, another thing that we have, as opposed to when should you see the podiatrist, what should they expect? What would be a typical appointment?
If you're a new patient, and it's your first time coming in, you'd get brought back by the medical assistant to the treatment room, and then they would ask you some questions, just how long has this pain been going on, or where on your foot is it hurting, or kind of just get a history. If you needed x-rays, someone from the x-ray area would come get you right down the hall, take you there, and then bring you back to the treatment room. After I've had a chance to look at the x-rays and listen to the history or read the history in the chart from the medical assistant, then I would go in to meet you and then show you the x-rays, examine the foot, kind of talk about what I think the diagnosis is, and go over what we can do. So sometimes that first visit, you may be leaving with a prescription or a referral for physical therapy, or we might do a procedure in the office, like an injection or like a toenail procedure, something like that. It takes, 15, 20 minutes typically, length of a visit. Depends on what you need.
20,
it might be
25 minutes
longer
probably.
if you need x-rays, it might be longer if you need a procedure, but that'd be a pretty standard kind of what happens in the visit type of deal.
I mean, I always tell patients to be patient too. There's a lot of moving parts. We do have x-ray in-house. We do take a lot of people from the urgent care, people that come in for urgent needs. So, I mean, sometimes the door-to-door on a new patient is closer to 40 minutes or an hour because of the moving parts of getting to x-ray, and they're doing x-rays for the whole building, getting back. We have to look at the x-rays. So I think, just being patient with us too, because we are trying to accomplish a lot in that first visit. We want you to leave with answers. We don't want you to feel like you came in, we rushed you out. So I always tell my patients when I walk in, I want to make a roadmap. You know, this is what you have, this is what we can do, this is what we can do that's more aggressive, this is the surgery, and then we, you know, talk and figure out what the best plan is going to be. So sometimes that takes some time, and I think that just being understanding and that we want to have everyone leave feeling like they have a solution, or at least a roadmap to a solution.
Well, and like we talked about, we see so many different things from dermatology or skin-related issues to biomechanical issues. So it does depend on what your chief complaint would be, your chief concern. So depending on the concern, it may take a little bit more time. Sometimes I see things very quickly. We do often have patients who come in with multiple concerns, and we want to address all of them at once, but sometimes we just don't have the time built into the schedule for that. So we want to make a note of that in the chart and come back to that at a later visit if we need to have some more time. But yeah, it is a very, we try to streamline it as much as we can. In, vitals done, quick history, get an x-ray if we need it, talk about whether or not a procedure needs to be done. I'd say all of us agree that we'll try to do those procedures if we can to save you time so that you're not having to come back for a procedure. But sometimes we can't. There are days when we can't, or if we're behind, or, you know, but we try to get those in.
And as we're wrapping up, what's something that you would like people to know that we haven't discussed, just about coming to a podiatry appointment, or something that people overlook?
Specifically about an appointment, my, and I tell patients this too, if I do any referrals, let's say to another office, I always tell patients to arm themselves with all of their x-rays and any information they can. That is one of my biggest weapons that I want patients to have in their armoire. That come to me, if you have x-rays from an outside source, know where you got them done, or have them ahead of time on a disc or a report or something so that I have something to work with. I can try to track down that information, but sometimes it's challenging. There are patients sometimes who don't know where they got their x-rays done. It slows things down, especially if they don't want a new x-ray in our facility. But there are times where I refer them out to somebody as well, and I always tell them, take everything that you can with you, print it out, have it in your hand, because in the event that you see this individual, this other practitioner, and they have questions for you, you'll have it in your hand and ready to answer those questions.
Okay.
I guess, I don't know, I'm going to go a different direction. I think that a lot of people, our practice is special because we're all in the community. We all live here, we all work here, our kids all go to school here, and we all love Richmond. We love the surrounding area. We like being part of this community. We want to be here, and we want to be able to help people in the community. So I think that coming in with an open mind, knowing that we are on the same team, that we want to be here, that we want to, you know, support the people that live here, and we love living here. I think it makes our group special.
And on that note, I'm going to have to thank you. I'm sorry I didn't get to ask you.
That's what I was going to say. You took my answer.
We want to thank everyone for joining us today on Let's Talk Together with Reid Podiatry.